Delighted to be joined today on EHI TV by Dr. Mohammad Al-Ubaydli, the Managing Director, Chief Executive of Patients Know Best, who are the most innovative personal health record company in Britain. And without further ado, perhaps you could tell us a little bit about Patients Know Best.
Sure. Thank you for inviting me. We provide a patient-controlled medical record system. So the clinician gives an account to the patient. The patient then invites everyone in their clinical team, teaching hospital, local hospital, GP surgery. And then they just start doing things with them, whether it's an online consultation, receiving their prescriptions online, explaining their test results, personal health plans. They just start doing useful things with their clinical team. And the key is that because the patient's in control, the governance is really easy to connect all the settings in which that patient receives care.
And the patients actually invite their clinicians, their chosen clinicians, to access the record. Again, how does that work?
So to patients, we say it's a bit like Facebook without the privacy problems. So you click to add a friend, you click to invite a clinician.
So is it quite literally a social network type model where people are evangelizing and inviting others to join?
Yeah, so we call it a private social medical network. And yes, but they do get really excited about what this can do for patients. And they do convince other doctors and nurses that I really need this for the patient care.
How did Patients Know Best come into being? I understand that it's quite a personal thing for you.
Yeah, so to me, I just built it for myself. I was just trying to solve my own problem. So I have a rare condition, genetic immune deficiency. So I'm literally 1 in a million. And I was noticing that when I go and see my doctors, they would ask me what to do next. And initially I thought it was because I'd gone to medical school and they'd trust me. It was nothing to do with that. It was just, I was the only one who had gone to all the appointments. The doctor would ask me what happened when I saw you 6 months ago, or what happened when you saw the other doctor 6 months ago. So I thought, well, if I had all my records, I could help the doctor or nurse that was looking after me there and then. That would save them time and it would improve my health.
A lot of people involved in more traditional aspects of health IT have been skeptical perhaps about patient-held records, personal health records, the involvement of the likes of Google and Microsoft in that space. But just one more time, just so I'm sort of absolutely clear on it, the value of personal health records is principally what?
It's basically workflow and safety. You mentioned patient-held records. These already work. They're called the Red Baby Book. They're all over the UK. Mothers are using them every day. We know the model works. If you leave outside the UK, I get asked to speak in different parts of Europe, and the normal lecture I give about it's important to give patients the copy of the record. They understand what I'm talking about because they've been doing this for decades. It's what you do. The French patient goes around with their X-ray from one doctor to the next. And so the model works. The question is, if you digitize it, can you do something that couldn't be done before? The answer is, of course, yes.
And security is always raised as an immediate concern about patient-held records. What sort of certification does Patients Know Best have to be used within the NHS?
So there's 3 levels of security that we do. So one is obviously between our computers and the patient's computer. We do SSL encryption. That's the same as credit card security when you use the internet. Secondly, our computer is hosted inside the N3 network under ISA 27001, so it's the international standard for secure management of a server. But the thing that we do that nobody else does is that we encrypt all the patient data at the patient level. So every patient gets their own private key. And if anybody were to hack in, so it's not that we're saying that no one can hack into our system. We are expecting someone to hack in, because at a certain point, there will be so much valuable data, everybody wants to hack in. We're saying when they do hack in, they will find nothing but a string of 1s and 0s that no one can interpret, because each patient has their own private key, and only that private key can unlock that patient's records.
And where are you beginning? Can you mention some of the sort of trust you're working with and the sort of areas that they're actually using these types of records?
So just to give you some examples, Great Ormond Street Hospital's gastroenterology team began doing this with their patients. Imperial College Hospital's neurology team is about to start doing it with thalidomide trust patients. So these are patients from across the country. They need to see their sleep specialist, not only to reduce the time and expense of travel, but the harm of travel. They're in wheelchairs. And now we're getting to the stage where local hospitals are also asking for this. So South Devon just signed on, and they're using it for speech and language therapy, cystic fibrosis, colorectal cancer. So pretty much any specialty can benefit from this.
And I understand that as well as the actual record, that they're also offered a number of communication tools so they can more easily contact and discuss matters with their doctor or clinician. Perhaps you could give a few details.
Within 1 hour, you can sign up all your patients. Those patients can send you secure messages straight away from any web browser or anywhere in the world. And we always say their smartphone and Nintendo Wii is kind of the example. They can also have structured online consultations, so any symptom that the patient has, our software will ask them all the questions the doctor would have wanted answered and tailor them based on the speciality of the doctor. And we just added Skype video integration, so you can actually also have a Skype video consult, so telemedicine that works, basically. And then we just add all the other workflow tools, and every customer that signs on also says, I love the system, but could you also add this bit? And we think, great, we'll just keep on adding features, we'll keep on adding integration, and we'll just build it as what the users want.
And the sort of UK government, in the shape of Secretary of State for Health, Angela Annesley, has been very clear about saying that he wants patients to control their records, something which some people have questioned whether the full implications of that have sunk in. And that call for the creation of circumstances that would enable a market to develop, are you optimistic that advice is likely to be followed?
I am an optimist. I mean, I will say there's a lot of data that says trying to give it to one vendor or trying to build it yourself is a failure. And so you're kind of just left with one other option, which is let the marketplace rule. The flip side is our new swashbuckling government actually quite likes this politically and intellectually. So it fits quite nicely.
Okay. Well, we'll see what sort of comes in the information strategy, which is due shortly. And we also look forward to welcoming you as a speaker at EHI Live in November. Dr. Al-Ubaydli, thank you very much indeed for joining us on EHI TV.